Hi, welcome back to Nursing Exam Insights. Today we'll see a question regarding the disaster management. The question is, while preparing and writing the hospital disaster management plan for fire emergencies, that is code red, which of the following should be the nurse manager's highest priority? Options are A, implement infection control measures, B, conduct staff orientation and training, C, provide patient education regarding fire safety, D, plan for safe patient relocation and evacuation. Let's understand the type of disasters. And if we consider a hospital scenario, we do have internal disasters and external disasters like fire, and it can be bomb threat, failure of utilities, and medical emergencies. But the external disaster can be like a flash flood, earthquake, and structural collapses. Let's see the key components of disaster planning. These are preparedness, mitigation, response, and recovery. Let's see one by one. The preparedness. What do you mean by that? Preparedness. So being ready before the disaster happens. So by this, we ensure all the staff know the procedures, their roles, and how to evacuate safely, and make sure all they are competent so that your plan will work when a real event happens, isn't it? So it includes staff education, and it includes training, then mock drills. So you establish a communication channel and assigning specific roles and responsibilities. So this is coming under the preparedness. Next is mitigation. Mitigation is reducing or preventing the impact of disaster, which means you identify potential hazards like fire, flood, explosion, and epidemic, and you conduct risk assessment in all hospital areas, implement safety measures like fire alarms, exits, infection control, etc. So this is the second one. Then we have the response. Response is actually something happens. So activate the disaster plan. Whatever you have planned before, now it's come to the action. Immediately perform triaging, you sort the patient by urgency, you evacuate, relocate, and patient safety will be the first priority over here, and maintain a clear communication and coordination. So that comes in the response. Now, the recovery. What do you mean by recovery? You are returning to normal after the disaster. So, here restoring normal hospital operations as before, providing psychological and emotional support to staff and patients, then evaluating the effectiveness of the disaster response is come here, then conduct debriefing sessions and update the disaster plan. So, these are the four components of disaster planning. Now, we will see the answer. So the question is clearly mentioned, the disaster management plan. So we are writing the plan and which will be your highest priority. So as per the steps we discussed before, the planning phase. So which will be very important, conducting staff orientation and training, isn't it? So that would be the highest priority. So that is the answer. And you can eliminate other three as well, like implementing infection control measures and patient education important but are secondary to ensuring the staff can respond effectively. And the D option, plan for safe patient and relocation and evacuation, it comes especially as a response phase, isn't it? Like when the actual happens, when the code red or the fire happens, the D priority comes. But this is about the planning stage. So here the D will be the right answer. Hi nurses. If you find the video useful, please like, share the video with your nursing friends, and don't forget to subscribe my channel Nursing Exam Insights, your ultimate resource for all nursing exams. Thanks for watching.